Hey, good morning, Casey and Hector.
Good morning.
So good to be back here on another Friday morning vlog. So today I wanted to talk about a subject that is the brand of practice that we are, if you will, and that is a COIS practice. So a lot of my patients, I don't know if they're familiar with that as a type of practice, but I'll tell you a little bit about where it comes from, because sometimes we have a patient that comes in referred from another part of the country. Let's say they have a great dentist where they are, and just like one of my patients that would have to leave, they're asking for a referral on where they're going to find a dentist in Nashville or LA or wherever. This could be a big issue for people. And so a referral may come to us from another doctor's office, and they were looking for a COIS dentist. And what a COIS dentist is a dentist that has graduated from the COIS Institute, which is a postgraduate education where dentists that have been out practicing go and learn dentistry. And it's a very organized institution that is dedicated to excellence in dentistry. And I mean, that's their tagline, is excellence in dentistry, and they mean it. And the way that they go about it is in a very structured, organized way on evidence-based dentistry, which is nice because if there's one thing dentistry has lacked, it's a bit of more structure and protocols for treating a particular problem. Okay, so medicine's great at that. Medicine goes through algorithms that will treat a disease pretty much in a standardized way. Dentistry has not been that way. And it's good and bad, right? Because a lot of times if I were tied to an algorithm to treat most of the things that I see in dentistry, it would be a nightmare. I would not want to do that because there's so much nuance and so much that's hands-on, whereas in medicine, it's just a different animal, right? You throw a drug at it, see how it responds, and go from there, and you have to have a treatment flow. So in any case, there is need for structured treatment planning, and so dentists can make decisions based on evidence. And that's a great thing about the COIS Institute is they have an army of researchers that are doing research projects on, for instance, what is the best toothpaste out there? What is the best material to fill a cavity with? What's the best material to do a crown with? What's the longevity of a bridge? What's the type of implant that you would like that's going to give you the best results and the best aesthetics? On and on and on and on and on. So I'm out there as a dentist thinking, I'd like to know the answers to these questions because when I'm practicing in Brandon, Florida, in the middle of a busy week, I have no idea what the rest of the country is doing, nonetheless the rest of the world. Would it behoove me and would it be helpful to my patients if I could bring, as I've always said, world-class dentistry right here to Brandon, right? So that is what it supplies. And that is what I have gotten out of it, is when I make a decision, I can look at you straight in the eye and say, this is a decision that is going to get you results. And it's not based on what I've practiced in Brandon, Florida. It's based on what the best dentists in the world are doing. So that is a huge benefit. Now, it's not easy to get this education. Why? Because you have to go all the way out to Seattle, which is the furthest place you can go in the United States outside of Tampa, Florida, right? You could not go any further aside from Alaska. And I'm thinking, this is a strategic disadvantage for John COIS to be out there in Seattle. But he doesn't do anything by chance. As you realize when you go to these courses, there are dentists from Japan, there are dentists from Russia. In fact, dentists from Florida are very, very underrepresented, probably because of the distance, right? and even dentists from the United States. The dentists from the United States may make up 1/3 of the dentists there. So it's difficult for that reason, just the location, geography, the cost can be prohibitive, and the time that you have to take out of your practice is very, very difficult. So if you're going to do something like this and you're going to be a graduate from that, you need to know that it's worth your time, because there are actually 9 parts to it. And each part is a minimum of 4 days. So if I'm going to go out there on a Sunday and return home on a Friday, and be away for that many days when I could be with my family, or I could be making money at the practice and working on my life, yes, it has to be something worthwhile. So what do you do when you're there, and what are the 9 different parts of it? Well, it starts with diagnosis and treatment planning. And so learning that new patient exam that we do, right? And then you break down basically the parts of the new patient exam like we would in biology, perio, functional risk, aesthetic risk, and each one of those becomes a seminar. And then they've expanded to, as technology improves, to add new seminars in advanced levels. So you may have bio part 1 and 2, perio part 1 and 2. So overall you have 9 different parts of it.